Hi, Charlie. I want to welcome you to our office here. I want to introduce myself, and my name is Casey Dodge. You can definitely call me Casey. You don't have to call me anything formal. And I'm going to be part of your social work team. I wanted to get your information today and just make you feel comfortable here and ask if you have any questions and just let you know what's going on. So, first, I want to tell you that we're here to figure out some of your issues that are going on and some of the symptoms that you're having, and just for me to get a really good understanding on the things that you've been struggling with here lately. I do want to thank you for being here and discussing all this with me because I know it can be really hard, especially at your age. And a lot of times kids come in here and they're pressured by their parents, or they just feel pressured by, kids at school just making fun of them because they have things going on. So I want to thank you for being here and thank you for being brave. And just let you know that this is just an assessment, just an evaluation, just between me and you. Everything's going to be kept confidential, and nobody's going to be told anything that I take notes on. And do you mind if I take notes? Do you mind if I write down in this assessment packet things that you tell me?
That's fine.
Um, and do you have any questions for me?
Not at this time.
So, like I said, I want to thank you for being here, and I do want to explain the whole confidentiality thing, and just let you know that everything that you say is between me and you. It doesn't go out of this room. Everything I write down doesn't go out of this room. Everything I put into the computer after our meeting doesn't go out of this room. It stays right here between me and you. Unless you threaten to hurt yourself or to hurt someone else, it does stay in this room. If you do threaten to hurt yourself or threaten to hurt other people, then I do have the authority to tell other people and give it to law enforcement or a medical office or a treatment center or things like that. Does that sound easy to understand, or is there anything else I need to explain?
No, I think I got it.
Okay, so this assessment is going to just go through things like your demographics, so your name and address, that kind of stuff. We're also going to go through your family members, so who all lives in your house, who's like a really good support system to you. Other basic things like emergency contacts and who your current doctors and therapists and that kind of stuff um, are right now. And then also some problems that you're having right now, some symptoms that you're having right now, and possibly discuss some like further treatment. So, are you ready to get started?
Yeah.
Okay, so the date today, let me write that down. And can you give me your name?
Charlie Kelmekis.
Okay, and can you spell your last name for me?
Kelmeckis.
Okay, so Kelmeckis, right?
Yep.
Okay, and what is your current address?
123 Main Street, Pittsburgh, Pennsylvania, 32128.
Give me just 1 second. And can you give me your zip code one more time?
32128.
Okay. And what is a good phone number? It can be your cell phone or mom's or dad's, whoever.
306 825 4586. That's my mom's.
4586, and that's mom's. Okay, and you don't currently work, right? Because you're in school.
Right.
Okay, and what is your birthday?
10/17/03.
Okay, and do you know your social security number? Could you give that to me if you know it?
I don't know it. My mom has it.
Okay, I will put that on here, and that's totally fine. And you are definitely not married because you're in high school. So.
Yeah, no.
Okay. All right. So next is going to be like your family system. So the people who live in your house. So, can I get the first one off the top of your head? So who lives in your house?
My mom and my dad and my sister and me.
Okay. And what is mom's name?
Barbara.
Okay. And how old is she?
She's 50. I think.
Okay. And what is Dad's name?
John.
And how old is he?
51.
Okay. And we already established that you don't work. So where do you go to school?
I go to Pittsburgh High School.
Okay. Okay. And next we're going to do emergency contact stuff. So who would be a good emergency contact for you?
My mom.
Okay. And you said her name was Barbara.
Barbara, yeah. And you can use that same phone number.
Okay. Let me write that down really quick. And do you want to put anybody else down as an emergency contact, or is that good?
I think just stick to my mom for right now.
Okay. And if you could tell me, who is your current doctor? So just like your regular doctor you would go to get your shots or a checkup or something like that.
Dr. Smith.
Okay. And do you know his phone number, or does Mom have that information as well?
Mom has the information. And Dr. Smith is a girl.
Okay. And is it okay if I contact your doctor for any reason or any questions that I have? Are you okay with that?
Sure.
Okay. And I'll definitely follow up with Mom and ask her that question as well. But I wanted to get your permission since we have this rule that if you're over 16 or 16 and over, then you can kind of consent for your own things. And that's why Mom doesn't have to be in this meeting. So I wanted to check with you. Is there any other specialist, like a therapist or anything like that, you've been going to or have gone to in the past?
Yeah, I've seen Dr. Burton before.
Okay. And what is Dr. Burton?
She's a psychiatrist.
Okay. And Mom, I'm assuming Mom probably has that phone number too. You don't just know it off the top of your head, do you?
No, I don't.
Okay. All right. And is it okay for me to contact her as well?
Sure.
Okay. And I will also follow up with her with Mama too. Okay. So the next thing we're going to talk about is some problems that you've been having recently. So anything from nightmares to just feeling super secluded at school, just anything you've been feeling. So what are some problems that have been occurring a lot in your life recently?
Well, I have been getting a lot of night terrors.
Okay.
And I've had a lot of flashbacks that cause panic attacks, and I guess, and my therapist says I have depression and anxiety, but what teenager doesn't have that?
Right. Okay, and when do you think this all started?
The symptoms or the...
Yeah, the symptoms when all your night terrors and flashbacks and panic attacks started. When do you think all that started?
I guess when I was about 7. That's when I remember the first one.
Okay. Okay, and so whenever these things happen, whenever your night terrors and your flashbacks, your panic attacks, anything that just like hits you all of a sudden like that, when do you feel like that's happening? When you're stressed out, when there's a huge crowd, things like that.
Yeah, when there are large crowds, that really freaks me out and can trigger it.
Okay.
And sometimes like family occasions, like big holidays and stuff.
Uh-huh.
Just because of why I have the terrors and everything.
Yeah. Okay. And whenever these things do happen, do you feel like on a scale of 1 to 10, how intense do these panic attacks get and how intense are the flashbacks? 1 being the lowest and then 10 being the highest.
I guess recently it's gotten better. It used to be about between an 8 and a 10, but now it's about 5 or a 7.
Okay. You said 5 to 7?
Yeah.
Okay. Well, that is good that it's improving. Another thing I want to talk about really quick is, and the section is called a precipitating event. So that means like, why now do you feel like you should be getting treatment? And why now have you and your parents decided to get you some treatment? Why do you feel like it's this, that the time is now for you to get treatment?
I guess it just kind of all of a sudden hit me. I mean, I met a girl and we hit it off, and I can't seem to have a proper relationship because I'm so like freaked out and plagued by what happened.
Right.
And I just felt like I could no longer deal with it on my own. I kind of recognized that.
Okay. And have you been talking about that with your therapist?
Yeah. Dr. Burton's been great.
All right. Okay, so just to make sure I got this right, you decided that you think it's time for you to get treatment now. This is not just your parents, correct?
Yeah.
Okay.
I mean, they're definitely part of my reasoning, but it's
Right.
me.
Right. And that is great. Okay, so the last thing that I want to talk about with you, I know this looks like a big packet, but there's only a few things that we have to talk about. So this last thing is going to be the symptoms that you think are the most important to target and to take care of. I know that a lot of things have a domino effect, and because you have anxiety, you then get panic attacks and things like that. But what symptoms are in the forefront and what symptoms seem to be the hardest things that you struggle with that you want to take care of?
I really want to get rid of the night terrors.
Okay.
I'd like to have, a full night's sleep.
Right, yeah.
Waking up sweating, heart pounding. And I guess the depression and anxiety, because I feel like that would get rid of maybe the panic attacks. And
right.
I don't know if it's even possible to work on the flashbacks, though.
Right.
But yeah, I guess the night terrors and the depression.
Okay. And I want to go back through some of this stuff to make sure we have it right. Is that okay with you?
Yeah.
Okay. So I'm okay with not going back over the demographic stuff. I know that's boring stuff, and I can verify with Mom on all that. But I want to make sure with like your issues and stuff that you've been having that we have everything right. So going back to, we can start with your therapist that you've been seeing. You said that their name was Dr. Burton, correct?
Yes.
And they're a psychiatrist.
Yes.
Okay. And the things that you've been talking about with them and with me today, some problems that you've been having were night terrors, flashbacks, and panic attacks.
Yeah.
Correct? Okay.
Yeah, that's right.
And it all started when you were around 7, you think, right?
Yeah.
Okay. And some of the things that can trigger them, you said, were large crowds or big family gatherings.
Yeah.
And the intensity of those problems has gone down, though, since you've been seeing Dr. Burton, correct?
Yeah. Yeah.
Okay, cool. Last thing I just want to go back over again. So why you want to get treatment now. I know that you did say that, and you confirmed that you have decided on your own. Of course, your parents want you to get better, which makes sense. But you have decided on your own that you want to feel better and to be better and to be your best, right?
Yeah.
Okay. And then all of a sudden, I did quote you on this, but all of a sudden you said you felt like it just hit you, that the moment came that, you moved and you got a new school and you got a girlfriend, and you feel like you don't want to be stuck in the past with all these things that have been going on. So that's when you decided you wanted to get help, right?
Yeah.
Okay, awesome. Well, once again, I want to thank you for being here and for talking with me. I know this isn't comfortable stuff and it's hard subjects, but I do thank you for being brave and for coming on your own accord. And I'm glad that you have a support system at home. And I'm glad you have mom and dad and sister. And I hope that everything can work out for you between Dr. Burton and myself and any other team members that you get to work with. And like I said, anything that you tell me, anything that I write down that you've said, anything I quote you on even is all confidential. I'm not going to tell anyone and share this information with anyone unless you decide that you want to hurt yourself and you threaten to do that, or you threaten to hurt someone else, say at school or wherever it may be. So I will keep this on file. I will not be showing it to anyone, but I will probably use it in our next session whenever we see each other, and I'll schedule that with mom. So does that sound cool? Does everything sound good?
Yeah.
Awesome.
So far sounds great.
Awesome. Well, once again, thank you for being here, and it was nice meeting with you.
It was nice meeting you too.